What are the next steps after a positive prenatal screening? Imagine finding out your screening test suggests a higher chance that your baby might have a genetic condition. It can feel overwhelming, but there are clear steps to take next. When your screening results come back positive, it means more testing is needed to find out what's really going on. It does not mean your baby definitely has a condition, just that the chance is higher. Most pregnancies with positive screening results turn out to be healthy. Your healthcare provider will sit down with you to explain what the results mean and discuss your options. One option is non-invasive prenatal testing, or NIPT. This blood test looks at tiny fragments of your baby's DNA in your blood. It's more accurate than initial screening and is safe for both you and your baby. If you had a positive screening, NIPT can give you a better idea of the chances your baby has certain conditions like Down syndrome or trisomy 18. It is usually covered by public health programs, especially if your initial test was positive. Keep in mind, NIPT cannot be done if you are pregnant with twins that are vanishing or if you have a high risk of a rare condition. Another option is diagnostic testing, which provides a definite answer. This involves procedures like chorionic villus sampling or amniocentesis. Chorionic villus sampling is done between 10 and 13 weeks of pregnancy, where a small tissue sample is taken from the placenta. Amniocentesis is usually performed between 15 and 20 weeks, where a small amount of amniotic fluid is collected. Both tests analyze the baby's chromosomes for genetic differences. These tests are more accurate than screening but do carry a small risk of miscarriage, about 1 in 100 to 1 in 300. If you choose diagnostic testing, your healthcare provider will refer you to a genetics specialist to guide you through the process. Some people decide not to have any more testing during pregnancy. If that's your choice, your provider may suggest extra ultrasounds or other monitoring to keep an eye on your baby's development. Between 18 and 22 weeks, a detailed anatomy ultrasound can give more information about your baby's growth and check for physical signs of genetic conditions. Remember, a normal ultrasound does not guarantee your baby is free from all conditions, but it can provide reassurance. If your screening shows a very high risk, such as an increased nuchal translucency measurement of 3.5 millimeters or more, your provider might refer you directly to a genetics specialist for further discussion and support. Whatever you decide, it's important to take your time, ask questions, and think about what feels right for you and your family. Your healthcare team, including genetic counselors, are there to help you understand your options and support you through each step.